Are you looking for ways to support your health and manage diabetes better? It's all about the right nutrients. In this video, we're diving into 4 powerful vitamins that can make a real difference in your blood sugar control, energy, and nerve health. Stick around to find out which ones you might be missing and how they can help you feel your best every day. Let's begin with number 1. The first vitamin we're talking about is benfotiamine, which is a special form of vitamin B1. Unlike the regular water-soluble form of B1, called thiamine, benfotiamine is fat-soluble, meaning it can enter your cells more easily. This is especially important for people with diabetes, as high blood sugar over time can damage nerves, eyes, and kidneys. High sugar in the blood leads to harmful byproducts that can build up in the body, damaging cells and blood vessels, particularly in areas with a lot of small blood vessels, like your fingers, toes, eyes, and kidneys. Benfotiamine helps move extra sugar through a safer chemical path in your body called the pentose phosphate pathway. This means less sugar goes down the harmful paths that form AGEs, advanced glycation end products, which are sticky molecules that cause tissues to stiffen and become inflamed. AGEs are a major contributor to nerve pain, slow wound healing, and organ damage in people with diabetes. By taking benfotiamine, you can reduce the formation of these harmful molecules, protecting your nerves and organs over time. In clinical trials, benfotiamine has been shown to improve nerve function. In one study, participants took 600 milligrams of benfotiamine per day for 6 weeks, and most of them felt less pain, burning, and numbness. Other studies showed that it improved nerve signal speed in the legs and helped with blood flow in the feet and hands. This makes benfotiamine an excellent choice for people suffering from diabetic neuropathy, a condition that causes nerve damage and pain due to high blood sugar. Benfotiamine is absorbed better in the intestines than regular thiamine, and some studies say it can increase thiamine blood levels 5 to 25 times more than regular. B1 doctors often recommend taking between 300 to 600 milligrams of benfotiamine per day, either all at once or in 2 smaller doses. It works best when taken with food. While benfotiamine doesn't work instantly, it builds up in your body over time. Full benefits can take 2 to 3 months, but the results can be quite significant. It's safe for long-term use and has minimal side effects, though some people may experience mild stomach upset or dizziness, which are rare. If you're on metformin, a common diabetes medication, benfotiamine can help counteract the vitamin B1 and B12 depletion caused by the drug. The second vitamin you need to know about is methylcobalamin, the natural and active form of vitamin B12. Unlike cyanocobalamin, the common form of B12 that needs to be converted by your body, methylcobalamin is already in a form that your body can use immediately. This makes it more useful, especially for people with diabetes or genetic issues like the MTHFR mutation, which makes it harder for the body to convert B12. When vitamin B12 levels are low, it can affect your nerves, memory, energy, and even your mood. People with diabetes, especially those who take metformin, are at a higher risk of B12 deficiency. Metformin can slowly lower B12 levels by affecting its absorption in the stomach. Methylcobalamin helps repair the myelin sheath, the protective layer around nerves. If this sheath gets damaged, nerve signals slow down or stop, causing symptoms like tingling, burning, numbness, or sharp pain, usually in the hands and feet. This condition is known as peripheral neuropathy, and it's common in people with diabetes. Many studies have shown that methylcobalamin helps improve nerve function. In one study, participants with diabetic neuropathy took 500 to 1,500 micrograms of methylcobalamin daily. After a few weeks, many felt less pain and more feeling in their legs and feet. Nerve tests also showed that their nerves were working faster. In another study, participants took 1,500 micrograms per day for 4 months, which resulted in better balance and longer walks without discomfort. Methylcobalamin also plays a crucial role in the production of red blood cells. Without enough B12, red blood cells grow too large and don't function properly, causing fatigue and weakness. Methylcobalamin also helps keep homocysteine levels low, a chemical that, when elevated, can damage blood vessels and increase the risk of heart disease. For diabetics, this added protection is especially important since high blood sugar already puts stress on blood vessels. Methylcobalamin is stored in the liver and used by the body as needed, and it stays in the body longer than cyanocobalamin. The recommended dose is typically between 1,000 and 5,000 micrograms per day, and it can be taken in pill form or as a sublingual lozenge that dissolves under the tongue. This method is especially useful for people who have difficulty absorbing vitamins due to stomach problems. It's a safe and effective way to support your nerve health, mood, and overall well-being. The third vitamin on our list is pyridoxal 5-phosphate, or P5P, which is the active form of vitamin B6. Normally, your body converts the basic form of vitamin B6, pyridoxine, into P5P before it can be used. However, in some people, especially those with diabetes, liver stress, kidney problems, or older age, this conversion doesn't work well. Taking P5P directly means your body can use it right away without needing to do any extra work. P5P is involved in over 100 different enzyme reactions in the body, many of which support nerves, blood sugar regulation, and neurotransmitter production. It helps create myelin, the protective coating around nerves. If this coating is damaged, nerve signals slow down, which can lead to tingling, numbness, and pain, particularly in the hands and feet. This is a common problem for diabetics who suffer from diabetic neuropathy. P5P helps repair this damage and supports nerve function. P5P also plays a role in the production of neurotransmitters like serotonin, dopamine, and GABA, which control mood, sleep, and focus. If P5P is low, you may experience anxiety, irritability, or fatigue. It also helps break down homocysteine, an amino acid that, when elevated, can be toxic to nerves and blood vessels. High homocysteine is linked to memory loss, blood clots, and nerve damage, particularly in diabetics. In one study, people with diabetic neuropathy who took 100 to 200 milligrams of P5P daily showed better grip strength and less pain in their hands. This is significant because diabetics are at a higher risk of nerve compression problems, such as carpal tunnel syndrome, due to long-term blood sugar effects on tissues. The usual dose of P5P is 25 to 50 milligrams per day, although in more severe cases of deficiency or nerve damage, doctors may recommend up to 100 milligrams per day. P5P is safer than high doses of regular B6, as it's more efficiently absorbed and cleared by the body. It doesn't cause nerve problems like regular B6 can when taken in high doses for long periods. P5P is often found in supplements with other active B vitamins, like methylcobalamin B12 and L-methylfolate B9. This combination supports nerve health, energy, and metabolism, which can be particularly beneficial for diabetics dealing with nerve pain, fatigue, or memory issues. The fourth and final vitamin we're going to cover is L-methylfolate, the active form of folate, or vitamin B9. When you take regular folic acid, your body has to convert it into L-methylfolate before it can be used. However, some people have trouble making this conversion, especially if they have the MTHFR gene mutation, which affects the conversion process. In these cases, taking L-methylfolate directly is much more effective. One of the most important roles of L-methylfolate is to help lower homocysteine levels in the blood. High homocysteine can damage blood vessels, nerves, and even the brain. This is especially important for diabetics, as high blood sugar already causes damage to nerves and blood vessels. By breaking down homocysteine, L-methylfolate helps protect your nerves and blood vessels. L-methylfolate is also essential for producing neurotransmitters like serotonin, dopamine, and norepinephrine, which help regulate mood, sleep, and energy. Without enough L-methylfolate, the brain struggles to make these chemicals, leading to symptoms like depression, anxiety, and poor memory. This is why L-methylfolate can be helpful for people with mood or energy problems, especially if they also have low folate levels. In addition to its effects on mood and energy, L-methylfolate plays a crucial role in DNA repair and cell division. It helps the body make new, healthy cells, including nerve cells. When nerve cells are damaged by high blood sugar, L-methylfolate helps repair them and keeps them functioning properly. It also works in conjunction with B6, B12, and other vitamins to support methylation, which is essential for detoxification, inflammation control, and cell repair. For diabetics with nerve damage, L-methylfolate, B6 and B12 can help reduce pain and improve nerve function. In studies, this combination has been shown to reduce pain and improve feeling in the feet of people with diabetic neuropathy. Additionally, L-methylfolate can help improve blood sugar control by supporting insulin sensitivity and glucose metabolism. The usual dose of L-methylfolate is between 400 and 1,000 micrograms per day, although higher doses may be necessary for people with low folate levels or genetic issues. In conclusion, these four vitamins, benfotiamine, methylcobalamin, pyridoxal 5-phosphate, and L-methylfolate, are essential for managing diabetes, supporting nerve health, and improving blood sugar control. Adding these vitamins to your routine can make a significant difference in how you feel every day, especially if you're dealing with nerve pain, fatigue, or blood sugar fluctuations. If you found this video helpful, please give it a thumbs up and share it with anyone who could benefit from this information. Don't forget to comment below with your experiences, and if you haven't already, be sure to subscribe and turn on the notification bell so you never miss an update. Thanks for watching.